Hello, good afternoon. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Thank you so much and welcome to our weekend open clinic. Today we're going to talk about Down's syndrome. Down syndrome. Now, this is a medical condition that so many people have completely mischaracterized. This is a condition that so many people have called so many names that are completely wrong. So I'm sure you've heard a lot of people classifying babies and people that have Down syndrome as imbecile, as idiots, as so many negative words. Now, this is really very unfortunate because it's completely not true. So what I'm going to do this evening is to help you to understand the basic medical condition called Down syndrome, what will likely lead to Down syndrome, and what you need to know about Down syndrome so you can make informed decisions. So what I'm going to explain to you right now are specific evidence-based information about Down's syndrome. So please, when you join, I need you to do me a favor. So I need to know who you are. So introduce yourself, make yourself comfortable, invite other people. So send this particular link to anyone out there, especially if you're poorly informed about Down syndrome. You're going to learn a lot. It's my belief that at the end of my presentation today, you can make informed conversation about Down syndrome, and you can also educate other people about Down syndrome. So when you hang around people and they begin to talk about Down syndrome, like, people that are not informed, you can actually educate them. If you currently have a child with Down syndrome, I also want to help you to understand it better. So after my presentation, you will have opportunity to get feedbacks. Now, I want to remind you about a couple of things we have lined up for 2024. Next weekend on Saturday, we have our first event in 2024. It's going to be amazing. Becoming Pregnant and a Mother Super Masterclass. If you are currently experiencing delays starting your family, becoming pregnant, but you want to end that struggle in 2024, you definitely have to end it by learning, by applying new approach so you can become a mother. You can become a mother in the next 9 months. You can become a father in the next 9 months. What you probably might be lacking might be the real knowledge. So go and register for that event. We have fewer slots remaining. When you're registered, follow due process and we'll meet you halfway. So today we're talking about Down syndrome. So you see, Down syndrome is actually a problem with the chromosomes. So it's a genetic condition which can happen to anybody. Now, for some strange reasons, this particular condition is commoner among women that are older. So when we compare younger women with, older women, so in medical practice, especially in fertility, the age of classifying women if they are older or younger is actually 35. So age 35 is the cutoff point. When you become pregnant and you're below 35, you are classified as still within young category. When you become 35, 36 and above, and you become pregnant, you are classified as advanced in maternal age. The reason is because there are a couple of complications. There are a couple of conditions that can pop up, like Down syndrome is common among women of this particular bracket. But Down syndrome can also occur in any woman at any stage, be it in her 20s, in her 30s, but it's commonly seen among women that will have their babies in their 40s, in their 50s. Now, it's a problem of the chromosomes. So chromosomes are clusters of genes which determines who you are. So your chromosomes are the composite genes which your two parents will transfer to you. Naturally, chromosomes, it's made up of complete sets of 46. So the combined number of chromosomes that would determine if you're going to be who you are is actually 46. So the 46 is comprised from 23 from your mother, 23 from your father to combine to give you 46. This is the normal combination of chromosomes you are going to have. Now, for some strange reasons, in people that have Down syndrome, for some strange reasons, which, is a combination of some, natural environment and a couple of other things we haven't really fully defined. In the chromosome 21, so remember I mentioned we have 23 chromosomes from your father, 23 chromosomes from your mother, and you have 46, right? Now, in the exact position 21, instead of that chromosome to just be by itself, it will go through abnormal cell division. When it goes through this abnormal cell division, it will create extra copy of that chromosome 21. When this happens, it will lead to genetic abnormality in that chromosome 21. So Down syndrome is actually called trisomy. So trisomy is a medical terminology in genetics that indicates extra. So the basic medical event that happened in Down syndrome is trisomy 21. So trisomy 21 is telling you that the problem we have is on chromosome 21. So they have extra genetic copy in chromosome 21. Now, when this happens, it begins to affect the way the baby is going to present. So it will cause developmental and intellectual problems. It will affect virtually all the organs in the body, how the organ is going to develop, how the baby is going to look, couple of challenges the baby is going to have. So remember that your chromosomes are small packages of genes that they will determine who you are. So when this happens, when the baby is born, there are different ways that these babies will present. So babies that have Down syndrome will tend to have a particular physical outlook. Babies that have Down syndrome will have delayed or absent developmental milestones. So a couple of things that babies are supposed to have at a particular time might be delayed in babies that have Down syndrome. But this is a fact you need to know. You should never call any baby imbecile. Babies that have Down syndrome are not imbeciles. They are not idiots. They can still thrive. They can still attain their potentials if we know the right things to do. So it's not a death sentence. They are just challenged. They are just any other babies out there, but they need more love. They need more caring. They need more understanding. And when we provide them with more love, care, understanding, education, they can attain their potentials in 2024. So it's completely wrong to name anybody imbecile because of whatever challenge they didn't even contribute to. So normally when a baby has Down syndrome, there are certain things you look out for physically. So the physical presentation can be affected by Down syndrome. The genetic component of the baby can also be affected by Down syndrome. So how you look, who you look like is called phenotype, which is the manifested trait which your two parents can pass to you. But when we talk about gene, we're talking about the genetic makeup in you. That's where we begin to talk about genotype, right? Now, babies that have Down syndrome will likely present with a flat face. It's very common out there. If you pay attention, you will notice a unique presentation of the face of babies that have Down syndrome. The flat face is actually more pronounced because they have a flat nose. So this bridge is completely flattened. This is one of the commonest presentations in babies that have Down syndrome. So that's number one thing to look out for. Number two, they tend to have almond-shaped eyes that slant up. Go and pay attention again. You will notice this. The eye tends to be almond in shape and it will slant up. This is also a common presentation of babies that have Down syndrome. Majority of them will have short neck. Majority of them will have small ears. So think about very small ears, very short neck, slanted almond facing eye, flat face, especially when you pay attention to the nose. These are likely commoner things you will see in babies that have Down syndrome. For some strange reasons, their tongue will also tend to protrude through the mouth. For babies that have Down syndrome, they also tend to have a tiny spot in the eyes, colored spot in the eyes, which I'm not going to bother you with the medical terminology. They also tend to have small hands and small feet. Then there's another unique thing you notice in babies that have Down syndrome. They will tend to have single line across the palm of their hand, the palmar crease. So you can see I have multiple in my own. In babies that have Down syndrome, they will just have single crease in the palm, in their body. This is also a presentation, a symptom of babies that might have, Down syndrome. They also tend to have small pinky fingers when, which most times will curve towards the thumb. They have very poor muscle tone and loose joints. They are shorter in height as kids and also as adults. So this is just about the commonest ways that Down syndrome babies, Down syndrome people will present. They will not all have this. Some will have some will have a combination of, here and there. Now, the big question is, will you abort a baby if that baby had Down syndrome? That's the big moral question. And it's a very tough thing because it's really sad. After going through up and down, you succeed in having the pregnancy you've always wanted to have. Then throughout, through the development of the baby, they will notice that your baby has Down syndrome. It's a tough place to be. It's a very, very, very tough decision. Nobody wants to see their babies compromised at all. Now, thankfully, we are in the era of grace. So there are a couple of things, which you can do to confirm if your baby's got any genetic problems. So Down syndrome is one of the syndromes. There are so many other chromosomal problems that can come in pregnancy, but Down syndrome is the commonest. So it's a very tough pill to swallow. There are so many families that have kids that are Down syndrome kids, and they are doing fine. They might not be able to be like every other kid out there, but they are very loving. They are just like any other kid out there. So normally, there's a particular stage you will come through in your pregnancy, and there are a couple of tests we can run to confirm if your baby is got Down syndrome or not. We can collect a couple of blood works, but about the 16th week, there are certain things we look out for in the neck of the baby. So about the 16th week, depending on where you go for your ultrasound, we can also know the gender of the baby. But there is something we call local transcendency, in the neck, which you can use to check. There are a couple of things we will do there, and you can tell us if this baby, it's, a baby that will likely have Down syndrome or not. So it's something that majority of, women about this week, normally it's from 18 to 20 weeks. It's called anomaly scan. So when you go for anomaly scan, if they have suspicion that a baby might be a baby that might have Down syndrome, they will take you through a couple of investigations, couple of assessments. And once it's diagnosed, definitely they will tell you and your partner. Now, they will explain everything to you and your partner. This is a very tough pill for so many couples. There are some couples that will come to terms with their reality. They might opt for abortion. When you are opting for abortion, you are not a bad person. I just want to get this point clear. When they tell you that your baby, who you have been praying for, you have been envisaging to see your beautiful baby boy, your beautiful baby girl, and suddenly they are telling you that this baby has got Down syndrome, or this baby is going to have problems, or this is going to happen. So many people will not really deal with that reality. There are so many couples that will opt for abortion. Medical abortion is your choice. It's a 50-50 choice. Now, there are so many people that will also, ride the storm. They will be like, no matter what happens, I'm okay. I'm going to stick with my baby. And they will go ahead and have the baby, and they will make provisions for the baby. So it's a tough place to be. Because at the end of the day, when we diagnose Down syndrome in your baby, in your pregnancy, the choice of what you need to do is yours, you and your partner. Unfortunately, there are so many families that have been damaged because the man sometimes will say, I don't want this baby, and the woman will say, I want this baby. And if they can't have a decision about it, it can break marriages, it can break relationships. Like in the typical case we were talking about today, the man walked away. The man asked the lady to abort the baby. The lady refused because, mothers, there are these special bonds that babies have with their mothers, because guess what? Your mother is going to be the person that will spend the 9 months with you. So you're closest to your mother by default. So it's tough to tell a mother to abort her baby, a real mother. So this lady said, no, I'm going to stick with my baby. And the man walked away. But the woman stuck to her gun and, gave birth to the baby and continued looking after the baby. And subsequently, developed another relationship and had other babies, and the partner accepted the baby, and the baby is just doing fine like any other baby out there. So the decision about whether you're going to abort the baby or you're going to keep the baby is based on what you guys want. It's based on your convictions. It's based on your understanding. It's based on everything you envisage. Nobody else can make this decision for you. It's a very tough decision. Very, very, very tough decision. Just like in pregnancy, there are a couple of other medical problems that might put the life of the baby in danger or the life of the woman in danger. And there are sometimes you have to make decisions. We've had cases when the life of the mother is in danger, the life of the baby is in danger, and you have to make a medical decision of either saving the baby or saving the mother. And most times, 99.9% of the times, we always go the side of the mother. And for the simple reason that if the mother survives, she can have another baby. But if the mother dies, that baby is gonna struggle. So there are so many tough decisions in medical practice. Sometimes we are caught up in a dilemma that we can't even solve. So if the life of the mother is in danger and she's pregnant, and we know that if we don't intervene, she can either die or the baby is going to die, it's a tough place for doctors to be. But most times, we always come to terms and swallow the pill and deal with our reality. So the same thing is applicable in this situation, for a family, believing God for a baby, and they're telling you that your baby has got Down syndrome, is a very, very bad place to be. So you just have to understand that is one of those things that happen in life, and it's not a curse. So babies that have Down syndrome is not a curse. There is absolutely nothing your village people got to do with Down syndrome. It's purely a medical problem. So don't go thinking, oh, it's because of what I did that God is doing this to me. No. And like I said, in as much as it's commoner among women that are older, it can happen in women that are younger. So this is something you need to be very conversant with. If you're a medical student in this gathering right now, you have to be very careful when you're discussing this topic, because it's very sensitive. There are so many misnomers out there. There are so many misconceptions. They are bullied, they are stigmatized, they are called several names, the commonest one being imbeciles. So if you're among the people that when you see other people that don't look like you begin to stigmatize them, you begin to bully them, you begin to use words to condemn them, you call them names. If you have ever used the word imbecile, just say, God, please forgive me, because I don't know what I'm doing. There is no baby. There is nobody that is an imbecile. It doesn't exist. I don't even know how they came about that word. So that's my quick presentation on this topic. And I'm going to sit back and I'll give you an opportunity to ask your questions. So please go ahead and start asking your questions. Okay? What's the difference between a child with autism and child with Down syndrome? So autism is more like a broad spectrum developmental problems, which can also emanate. So babies that have autism can actually look perfectly okay. But, in course of growing, we'll now begin to, pick up a couple of things that might make them to be classified as autistic spectrum disorder. It's a very broad spectrum thing. But babies that have Down syndrome, when we hunker down to do the investigation, when we go to their genes, we're going to discover that extra chromosome 21. We're going to know it's trisomy 21. But when you go to babies that have autism, they will have everything pretty much okay. But in course of the development, you begin to see the difference. Now, also babies that have Down syndrome, all the characteristic look I mentioned, you will probably see it in them. So these are the commoner things you should expect when you're thrown with such things. So sometimes They are used interchangeably. So sometimes we can mischaracterize a baby that have Down syndrome as a baby that have autism. So autism is not something that will manifest mainly as a phenotype. So it's not a kind of a physical manifestation. It's a developmental, brain development kind of thing compared to Down syndrome, that you can actually look at a baby or someone and you can say, this baby's got Down syndrome, and you're 100% correct. Okay, does the age of couple contribute to having babies with Down syndrome? Yes. The older you are, the more the probability, the higher the chance of having a baby with Down syndrome, especially for the woman. The age of the woman is highly predictive of occurrence of Down syndrome. Now, having said that, younger women can also have babies with Down syndrome. Anybody at any time, depending on the genetic composition, depending on the nurture, depending on a couple of other factors, can be predisposed to having babies with Down syndrome. Okay? All right. Do you have other questions? Dr. Ndiche, thank you so much for coming. Correct. Down syndrome is hereditary. There are some components of Down syndrome that will be hereditary. So, current researches are still ongoing. So there are some forms of Down syndrome that will have genetic, familial, lineage. So if you have someone in your family lineage that's got Down syndrome, possibility it will reoccur in your generation is there. So yes, it can be hereditary. Okay. All right. Do we have other questions? Please keep asking your questions. This is a very, very, and I repeat, I will add another very important topic. We have to change the narratives. We have to stop the stigmatization. We have to stop the bullying. We have to stop the name calling. Most times, people that don't look like us, people that don't think like us, people that probably we see differently, we begin to bully them. We begin to call them names, and we're supposed to be Christians. We're supposed to be Muslims. And that's completely not good. Love people. When you can't love them, you just let them be. Okay? They can still start their families. Even babies that have Down syndrome can still grow into adults, and they can have their relationships. They can still attain anything they want to attain. They can still go to school and still study and become whoever they want to become. It might be delayed, but nobody can deny them whatever they want to do. Okay? Can the gene chromosome be corrected while the baby? No, it's not something anybody can. You see, anytime we are dealing with genes, we are dealing with chromosomes, we are dealing with DNA, there is no fix. It's going to happen, it's going to happen. So that error, once it's there, you can't correct it. So it's not like, oh, this person has Down syndrome, we'll do this to correct that. It doesn't happen. Genetic chromosomal problems, it's going to happen, it's going to happen. And that's why some women might have genetic or chromosomal abnormalities, and they will continue to have miscarriages and all that. And, like majority of women that will have the first miscarriage might be due to chromosomal problems, which absolutely there is nothing you can do about it. It's going to happen, it's going to happen. What we will normally do is to give you genetic counseling and run your family history. So some couples will opt to go for further testing, further genetic checking, and subsequently, depending on the outcome of the investigations, they will give you guys counseling. During the counseling, they're going to lecture you, they're going to educate you on the ability to make informed decision. So making informed decision will be a case like we just had now. Your baby is Down syndrome baby, and you guys are going to decide, are we going to abort this baby? Are we going to keep this baby? So you have to make informed decision. Informed decision means you've already understood the concept of Down syndrome. They've explained everything to you. You know the facts. You have the evidence. Then you will now decide on what you're going to do. And whichever way your decision goes, you don't beat yourself up. So if you decide to abort the baby, completely okay by you guys. If you decide to keep the baby, completely okay by you guys. So there is no, best answer or worst answer in that scenario. It's just something both of you need to agree on. You stick to that and you move on. There are so many families that have babies that have Down syndrome, then they have other babies that do not have Down syndrome, and you see them blending, they share love. There is absolutely nothing that love cannot conquer, including Down syndrome. I mean, capture that for me. There is absolutely nothing in this world that love cannot conquer. So love can conquer Down syndrome. You can use Down syndrome to defeat, you can use love to defeat Down syndrome defect, because most of the things we do in life is all based on the society. You know, some people will feel, I don't want people to see that I have a baby that is imbecile, because we stigmatize a lot, especially people from Africa. So the reason why some people will offer abortion is not because of anything, it's just because of how the society is going to see them. You know, because when they see the babies, they begin to use the babies to analyze the family. So majority of people will want to have their babies and you know, keep their babies, but they might want to go for abortion because of how the society will see them. Okay. I love the questions from Chinyere. Dr. Ndiche, do you have any question? Please, if you have any, quickly ask before I go. Remember, this is the last weekend for you to register for the masterclass. Go and register for that masterclass. Now, if you desire help, I can help you, but you have to follow due process, especially you have to be resident in Nigeria, and you have to get a package. Then when you're done getting your package, you send emails, we process you, then we set you up for consultation. There are different categories, so whichever one you can get based on what you can afford. You can come in for 1 week, 1 month, 3 months, 6 months. Then if you're currently pregnant, you don't want to mess with your pregnancy, so we'll definitely recommend you go for your ANC package. So whatever you decide, just make sure you come in so we can meet you halfway. Correct. There is absolutely nothing love cannot conquer, including babies with Down syndrome. With love, you're good, you're covered. Love is the universal coverage out there. Love is a beautiful thing. So you can use love to overcome a lot of things and you will still be fine. Okay? All right. So if we don't have any other question and if we don't have any other comment, I'm going to take my leave and I will come back again next weekend. Yeah, next weekend, hopefully. No, next weekend, I'm not going to come back because next weekend is our masterclass. Our masterclass is normally on Sunday, but this coming masterclass is going to be on Saturday. So you guys are not going to see me on Saturday. It's going to be the upper Saturday. And that will be sometime in February. Okay, so guys, take good care of you. Remember, if you're believing God to become pregnant and become a mother in 2024, it's possible. The best time to change your narrative, your life story is in January. So I want to challenge you to start your January right. So start saving, start keeping resources, start thinking outside the box, start getting the help you need, watch the videos, get some courses, and actually developed a very powerful new course in fertility, which we're going to launch any moment from now. So if you're not resident in Nigeria, and maybe for some reasons, you can't register for the masterclass, you can get a course. The course is a comprehensive, optimized female fertility management. So if you're hearing my voice now, I want you to gear up to get a copy of that course. It's going to change your life. It's going to change your family life. And my prayer is that by this time in 2025, you will have your babies in your families. Okay? So thank you so much for coming. I hope to see you guys next 2 weeks. Until I see you, God bless you and bye-bye.